Back when the pandemic started in 2020, I interviewed Dr. Joe Vipond, who's a Calgary ER doc. I interviewed him quite often because he was one of the sort of on the leading edge of progressive practices around the prevention of COVID-19, and he got into, he led some protests in Calgary and in Alberta, got a lot of attention, put a lot of pressure on the Alberta government. But I haven't talked to him for a while, and now that we're sort of back in, pandemic hell of a sort, I want to talk to him and see what he thinks about that, explain some of the trends that are going on, and what we can do about it. So, welcome to the interview, Joe.
Thanks for having me back.
Well, look, big thank you for all of the advocacy work that you have done over the almost 3 years, and I think one of the things that you've done for me is you've explained complex issues, complex science in very simple, easy terms. If I can understand it, then everybody watching this video can understand it. Please explain the situation we find ourselves in now, where we've got COVID-19, we've got the flu, we've got colds, we got this thing called RSV that I wasn't familiar with, and it's just created this hellscape of respiratory illnesses. Can you explain that?
Well, we've never seen this in at least in my medical past. And I think going back, we've never seen this kind of confluence of multiple viruses. And we can probably get into why that is. But really what parents probably care about is what to do about it. So all of these viruses floating around, they're all probably have an element of airborne transmission to them. There may be some what we call fomite transmission, which is when you touch a door handle that's covered in snot, and then somehow you touch your nose and your mouth, your eyes, and it gets infected. But there's definitely an element of airborne to all of those three viruses. So again, just like with COVID, we need to continue masking, and the best mask possible, which means a respirator style mask that fits well to your face, seals so that all the breath is going in and out through the fabric. And if you have the ability and turn up your ventilation, install filtration systems in public areas or areas where you gather with others. So that's how we deal with all of this that's going on.
Now, I made my first trip in October. That was the first time I traveled in almost 3 years. And I had to catch a couple planes, went to Ottawa, flew to Calgary. And I've been taking your advice. So I had a good elastomeric mask with a really good filter. And here's the strategy that I employed, and maybe folks can maybe find this useful. But I had a CO2 meter, a portable CO2 meter, and it measured CO2 parts per million. And the idea is it acts like a proxy for ventilation. So when you've got low CO2 reading, like between 400 and 1,000 parts per million, you're getting good ventilation. You can feel confident that the air is moving and there's a good HVAC system. When it gets above that, particularly above 1,500, and like on the plane, it would be like 2,300. Well, I wasn't taking my mask off. There was no chance. And what that allowed me to do, Joe, is in a long trip, for example, and this might be analogous to a parent, having a child in school, is when I knew, like when I was in the airport, and that the CO2 reading would be like 425 or 500. I go, okay, if I have to, take my mask off to eat or have something to drink, I can find some place that's got a low, and then I feel some confidence that I'm going to be okay. And it's those kinds of adaptive strategies that I haven't had COVID yet, and we're almost 3 years into the pandemic. And is that the kind of approach that parents need to take, even if it's not exactly what I did, but something, those kind of that approach?
Yeah, I mean, CO2 monitors are a great surrogate for ventilation. They're not perfect, because if you have really good filtration in the room, it's not going to affect your CO2. Your CO2 could be very high, but you could still be very safe. And in fact, some people would argue that those plane rides with the high levels are still relatively safe, because there's the system's running everything through a very good
HEPA filter, sure,
or HEPA filter. So you are relatively protected. So it's a surrogate marker, though, for ventilation. And in strange places you're not normally attending, it can give you that sense as to how well it is. It's not going to protect against close contact transmission. So if you're sitting right next to somebody who's spewing out virus, even if the ventilation is good, you still could be at risk. Think of it as in cigarette smoke. If you're in an area where the cigarette smoke would collect, and so your high CO2, you're at risk. But if someone's blowing smoke in your face, it doesn't matter how good the ventilation is.
Right. And what I would do when I was traveling is I would look for places away from people. Mm-hmm. So I would make sure that I at least 6 to 10 feet away from anyone else. And I might even go into the washroom and sit in one of the stalls, where I could be by myself, and I could tell with my meter what the CO2 reading was. And then I felt at least I had lowered my risk. And this leads to my next point here. Because Joe, earlier this year, I started noticing, along with a lot of other healthcare workers and doctors, that public health officials had moved from this idea of public health as collective responsibility for stopping the transmission of a disease like COVID-19. And suddenly we were talking about private responsibility. It wasn't up to the public health officers anymore to put in mask mandates or vaccine mandates or anything. It was like, no, you're on your own. You just go figure it out for yourself. And I am at a loss to understand when that happened. And was it a debate within the medical community that nobody else was aware of? Like, how did this happen?
Let's be very clear. The reason why public health exists is to minimize population level illness. And so there are elements of life that you can't mitigate against, right? If we were to let cholera run through our water systems, it's very hard to protect yourself from that. So that's why we have public health to put in these solutions that treat us all. And so a lot of us who care about public health really mourn the fact that public health seems to have given up on the idea that public health is for the public, and instead are trying to do these personal mitigations. Well, personal mitigations isn't public health. The other thing that I think people need to recognize is that they've stated that you should judge your risk of illness as to how well you should protect yourself. So, if you're at high risk because you're immunocompromised or you're elderly, or you live with somebody who's immunocompromised or elderly, you may behave differently than someone who is young and healthy, eats well, is fit. The problem with that is long COVID doesn't give a crap about whether you're vaccinated, about whether you're fit, about whether you're eating well, about whether you're on no medications. Long COVID could hit anybody. There may be different levels of risk depending on how healthy you are, but there are very healthy people that get long COVID, and we're not talking about long COVID as a population. We should be.
I want to get to long COVID in just a minute, because I remember you and I talking about it early in the pandemic, maybe 6 months in. And we seem to know so much more about it. We'll get to that in a sec. The thing I want to key in in the discussion about personal responsibility, doing a personal risk assessment when you go outside the house. Maybe you're going to work, you're going to school, you're going on a trip, you're going wherever. What's my risk? And and I don't understand how public health officials are not being called on this, because I don't have the information necessary to do an adequate personal risk assessment. I don't have data anymore. I don't have mask guidance. There's all sorts of things that I don't have. So how am I supposed to assess my personal risk? So the only thing I can do as a reasonable person is I just have to assume the worst.
Right.
And I always have to plan for
I think you're right. We're not doing any testing, right? We're not reporting that testing. No one's talking about the testing. I think there's 2 people in Alberta right now that are kind of analyzing the data, myself and Kyra Markov with CTV. So, and how many people follow our Twitter accounts? Not that many compared to the population. So most people are in the dark. Nobody's talking about what airborne transmission is, or the reason for a high quality mask, or the ventilation and filtration we're talking about. So we're told to do all the right stuff, but we're not told what the right stuff is and when to do it. So it's a very sad time for society, I would say.
I think that public health officials should be called on the carpet for this. And I remember there was a Twitter debate I had with Dr. Brian Goldman, who's the CBC's, what is it, White Coat Black Arts. And he said in a tweet, he said, people today have all the data, all the information they need to do a personal risk assessment to keep themselves safe from COVID. And I called BS on that. I mean, that is, and there is no evidence that we, as just the common, folks who aren't medical professionals, have access to that information. And yet that is the message that we're getting from, people like that with a high public profile, a doctor. We get it from the public health officials. And it's like they just don't want, they're just, that famous meme, where Homer Simpson fades back into the hedge. That's what it's like. That's what they've done. They've just absented themselves from the public discussion.
And let's be very clear that most citizens don't engage in critical thinking. They use this heuristic that we listen to our leaders. And so I don't blame citizens for not wearing masks. When I go to the store, I don't yell at, look at all you stupid people not wearing masks. No, they're not stupid people. They're doing what they're told to do. They are taking the information from their leaders and applying it to their lives. And so I very much want to make it clear that the people that are responsible for this situation are the leaders, not only medical, but political. And that it's not going to get better until we start. I mean, it's Markham, we've talked about climate change, right? Unless you deal with the core problem of climate change, which is burning fossil fuels, you're not going to win on climate change. Unless you deal with the core problem of COVID and that it's an airborne transmitted disease that's asymptomatically spread and that causes long COVID. And if you ignore all those facts, you're not going to win. So we need to start acknowledging the problem and doing what we need to do.
I want to bring up the example of Adrian Dix, who's the BC health minister. And at a press conference about 6 months ago, he said he got really irritated with some questions from a reporter. And he went, I don't have to tell British Columbians to wear a mask. Well, dude, you do have to tell British Columbians because just as you said, people don't spend a lot of time, being as engaged maybe as you and I are. And they rely on their government. When the government says it's bad enough to wear a mask, they'll wear a mask. When the government doesn't tell them that, they assume everything is okay. In the absence of guidance, they assume that there's nothing to worry about.
And it's even more than that, because that's why mandates were important, because you can see in Ontario, I mean, out here, they're not really doing this, but in Ontario, they've started to strongly recommend, right? Strongly recommend. And they really haven't seen the uptake go up that much because people use the mandate as a cue as to what's expected of them in society. And so strong recommendation isn't enough. A mandate does say, this is what we as society expect you as an individual to do to be part of the team. And so my feeling is until we start talking mandates, we're not going to win. And, honestly, Markham, I thought super sick kids, I thought children's emergency rooms would be enough to make our public health officials and our politicians shift. I thought that'd be enough. I knew that like old people dying, people were suddenly okay with that amount of suffering, but little kids, I honestly thought it would make the difference. I'm quite shocked.
Well, that makes two of us. Now let's talk about long COVID and long COVID. So there's a bunch of information, or background information we could provide. I've been reading tweets from doctors saying, look, it looks like every time you get infected, your risk of long COVID goes up. And it looks like I've even seen some doctors say, this is kind of looking like the HIV virus, where it hides in organs, it hides in tissues. And so you get sick, you get over it, and then it comes back, and it's really debilitating for some people. What can you update us a little bit on what long COVID is and kind of where we're at with it?
Okay, I'll start by saying we still don't really know. We don't know what the underlying pathology is. There's a bunch of theories. Virus continuing to live in the body, immune response to the virus, microclots. I think there's a couple other theories out there as well. But we really don't know the underlying pathology. And it may be that there's different pathologies for different people. But it does cause debilitating illness in some. Some it's just like a chronic cough. Some people it's insomnia. But the people that are really being impacted are the fatigue, the shortness of breath, And then there's also this whole phenomena of people getting sudden death, cardiac illness, pulmonary embolism. That's kind of a whole other separate category of like acute on chronic type of phenomena. In any case, it seems to be affecting a pretty high percentage of the population, depending on what you read, 10 to 30% of adults and somewhere between 2 to 10% of kids. And we have no treatment for it. Like we have no hard and fast therapy for this. People are using physiotherapy, symptom management, those kind of things, but we don't actually have a treatment for this. So you can imagine that there are actually millions of people in the United States and at least hundreds of thousands in Canada, if not millions, that are impacted by this every single day. And of course, that's going to have an impact on our society. Of course, that's going to have an impact on our staffing of any type of industry. And so people need to protect themselves with this, because the only way to really deal with this is to not get infected.
Now, I happened to read a news story about a study this is a couple of months ago, and it was all on COVID. And the numbers that they had were 20% of all people who will get infected will get some form of long COVID, from mild to severe, but 6% of them will miss work for more than 3 months.
Mm-hmm.
So when we look around, with the economy, and all of the labor shortages, and the short labor shortages in the healthcare system, and all the problems that that's causing, and then various other industries that we rely on, and the restaurant industry, and all kinds of them, and we're sort of making the connection. Well, people are sick, but we haven't made the connection yet to long COVID, and it looks like that as time goes on and more people get severe long COVID, that number has to grow, that has to multiply. And this becomes an economic issue. It becomes a financial issue, because if you're the breadwinner and you can't work for 3 months, who can afford that? What if it's 6 months?
If you're a shop owner and you can't hire staff, I mean, if we want to just talk pure economics, like this is a big deal. The other thing I think that, you kind of touched on a little bit, is this idea of immune dysfunction. And I think there's very real reason to believe that some of the severe illness that we're seeing right now in kids, but also in adults, is due to some kind of post-COVID phenomenon, where people are, because we don't seem to have more RSV, and we know the RSV isn't any different than the past RSV due to sequencing. It's the same RSV, but yet people seem to be reacting differently. And the concern is maybe that is immune dysfunction.
Yeah, I've seen that debate, because there was the immune debt argument versus the immune theft argument. And maybe you want to explain that for us.
Well, there are certain people that are arguing that because we haven't had a lot of illness over the last 2 years, our bodies aren't used to this, our immune systems aren't exercised enough, and therefore people are getting unwell. There's a couple problems with the theory. The first problem is a lot of people pushing this idea are the people that were saying that we should allow Omicron to rip through society and try and chase herd immunity. So they have a bit of an intellectual conflict of interest. If it actually turns out that that was a really bad idea, then and it actually has caused immune theft, then that impacts them. The other thing to think about is this same phenomena is happening in Sweden, it's happening in Florida, it's happening in Switzerland, it's happening in these locations where there really wasn't any decrease in illness spread, right? Like there was almost no masking in those 3 locations. As Sweden and Florida in particular just kind of let her rip, right? And so they are still dealing with the same phenomenon as we are, and yet they haven't had that. So one of the things when you look at a theory is you need to see whether you can make predictions based on that theory that would bear it out. And I would say that the prediction would be that those places that haven't had the same amount of precautions should be protected. We're not seeing that, and therefore we got to be suspicious about that idea.
Right. Just to sum up, so immunity debt is we were mitigating, we were avoiding, we were masking, and so our immune systems kind of got lazy or
out of practice.
Out of practice. Thank you. That's a good way to describe it. Whereas immunity theft is you've got COVID maybe once, maybe twice, 3 times, who knows, and it's damaged your immune system. And now that makes so even if you just get a common cold, influenza, something like that, then your immune system has been damaged and it's less able to cope with that, and they become more ill, more likely to be in the ER, more likely to be hospitalized, maybe even die. Have I got that correct?
Yeah, and the reason why this is really important to get right is because the two responses are dichotomous, right? If it's immune debt, we should be going out and getting as much infection as possible, right? We need to bathe in the infection in order to keep our practice up and stop masking, let it go through schools, whatever viruses there are. If it's immune debt, theft, then what we need to be doing is really protecting ourselves from COVID. If you've had COVID once, make sure you don't get it a second time. If you've had COVID 4 times, make sure you don't get it a 5th time. If you've had COVID 0 times, make sure you don't get it for the first time. And so because the response to the two theories are so in opposition, getting this right now is really important. And
isn't there, okay, now I've heard you talk a lot about the precautionary principle. And since we don't really know whether it's immune theft or immune debt, it seems like if I was looking at this and going, well, if I had to hedge my bets, if I was managing my risks, if I assume that it's immune theft, and I would protect myself more, what's the worst thing that can happen? I've been protecting myself. It's no big deal.
If I assume 3 diseases, right? There's influenza, RSV, and COVID. COVID and influenza, we have vaccines for. RSV, they're developing one rapidly. Worst case scenario, you mask, you protect against those 3 illnesses, you immune yourself you get your shot every year. And when RSV immunization comes along, you get that as well. I think the idea of letting it rip, especially because the people that are promoting these theories have been wrong multiple times through the pandemic, we should be really turning to those thought leaders that have been ahead of things.
Right. Like you. But
I don't know if I get all these ideas from smarter people than me, but I'm okay at communicating them.
Yeah, you say that, Joe, but trust me, in my world and in the average world, you're a thought leader. So just you're going to have to accept it gracefully, my friend.
Right.
Now, look, but here's the thing. I suspect that a year or 2 or 5 years from now, there are going to be people who find themselves with long COVID and are crippled. They're debilitated because they let it rip and they got infected a number of times. They got the worst case of long COVID, not the least impactful case. They got the worst case, and they're going to looking back and we're going to have a huge burden on the healthcare system. We're going to have a huge burden on the economy, a huge burden on families, and especially if children are injured in the way it appears that they might be. Why would we not want to avoid that?
These are deep questions, Markham, as to why society has opted for this. And one of the things that we need to be clear, it's not just BC, it's not just Alberta, it's the Western world, right? China is even starting to bend away from its zero COVID policy. Japan's probably still the place we should be trying to emulate. And I would say, even more than China, Japan has really promoted respirator mask use and the methods of trying to do airborne mitigation. Until we start doing that, we are going to continue to fail. And pretending it's not even an issue like we are now is
my personal take on this is that at least some of the responsibility lies with those people who are anti-vax, anti-mask, and made a big deal out of it in the summer of 2022 and 2021. Attacking the prime minister and all being violent and the convoy in occupation in February in Ottawa, that sort of thing. I think that has put a chill on not just the politicians. I think the public health bureaucrats. I think they're worried about that.
Let me challenge that by saying that public health laid the groundwork for this, right? They promised the pandemic would be over once we were vaccinated, but we knew this wasn't a sterilizing vaccine. We knew it wouldn't make the transmission go away. All it would do would decrease ICU and hospitalizations and death, which is important, but not enough to actually stop the pandemic.
Right.
We know that a lot of public health people, even now, are minimizing the utility of masks and still minimizing the importance of airborne transmission. So this has all laid the groundwork for, you know, those people who want to challenge what needs to be done. They have the tools thanks to our medical colleagues.
Well, Joe, we're not done this conversation by any stretch. I'm sure that I'll have you back for interviews in the future, because it looks like this is going to stick around for a while yet. We are in a sad situation, and like you, I mean, I've got grandkids who are in daycare in Calgary. My daughter's a teacher in Calgary, and it's just overwhelming. And I fear for them, and I'm sure, you know, I'm one of millions in that situation. So,
but Markham, you haven't got COVID. I haven't got COVID. My kids haven't got COVID. That's because we know how to protect ourselves, and we just need to have more of the population taught how to do that, so that we don't have this rampant spread. It's not an impossible situation. That's the sad thing. We have solutions.
Well, look, I'm going to close off this interview with a plea. If there's anybody who's watching who is not convinced that mitigation and stopping the transmission of the virus is the best way to go ahead, we'll get Joe to give you his Twitter address in a minute, and you can check him out. He's on his timeline. There's all kinds of links and all kinds of information that's very, very useful. And I'd encourage you to follow him and check out his information. Joe, what is your Twitter handle?
For as long as Twitter still exists, it will be Vipond MD. So,
okay. Well, look, we hope we've done something useful here. Thank you very much, Joe.
Thanks for having me on, Markham.